Have a headache, the worst, when you describe it, you just say that it's the worst. I've never had this headache in my life. The pain is unbearable. I can't bear the pain. It's extreme. Please immediately go consult. It could be a very serious thing. Hello family, I am Dr. VQ, your registered homeopath in South Africa, and today we are talking some things headache. So if you love the content, please stick around and yeah, let's share. Also, if you have anything to share around headache, what you've experienced, what other people around you have experienced, and what you've done, please share in the comment. Please like, share, subscribe, and stick around. So, headache. Headache is not necessarily a diagnosis on its own. It is usually a symptom of an underlying condition, meaning that there is usually a cause for the headache. You don't just wake up one day and just decide, you know what, I have a headache and that's it. There is something to it. Hence, whenever you have a headache, you really need to assess the intensity, the time of occurrence. Is it persistent? Does it come and go? Are there particular times where it occurs? What makes it better? What makes it worse? Where's the location? Does it move around? Is it on one place? Does it affect both sides? You know, things like that. There is a lot. You need to assess it and know. Don't just go to a doctor and say, I have a headache for this long. No. Although a doctor, yes, would assist you by us asking questions and finding out and trying to find out what causes that headache. But it's important to know it for yourself so that you watch out for things that could be emergencies. So let us begin. I've already mentioned that a headache is a symptom of an underlying condition. I'll start with simple ones. There are migraines. It can last for years. It is difficult to treat, can be difficult to diagnose because it has lots of triggers. It can be triggered by various things. Other people react to caffeine. For other people, it's light. For others, it's noise. So it has different triggers, right? You need for some, it's even food, like when they have caffeine or when they have dairy, then they start having this migraine. And some things we really can't avoid, or it's difficult to resist, like cheese, or chocolate, so they suffer because of that. So you just gotta know your triggers when it comes to migraines. Know your triggers. Try to avoid your triggers, and try to treat the symptoms. When it persists, when it occurs every single day, it becomes a challenge, because generally when you avoid triggers, then you should be fine. But when now you experience it every single day, please consult. Okay, number 2. So when you have a headache, the worst, when you describe it, you just say that it's the worst. I've never had this headache in my life. The pain is unbearable. I can't bear the pain. It's extreme. Please immediately go consult. It could be a very serious thing. You could be looking at things like your aneurysm, things that need medical attention straight away. So if it's the worst, especially if it's like lightning kind of headache, the pain strikes, you really need to go consult. Yes, could be a medical emergency. If you experience occipit, you have headache just at the occipit, or tension headache, you might feel the muscles at the back of your neck might really be tense. That could be stress related. You need to just deal with the stress, but as you deal with the stress, also try and massage. Use some magnesium oil to help relax the tension in the muscles, and take in supplements that will help you deal with stress. I love ashwagandha, mostly because it does quite a lot of things. really, it adapts to your body, right? If it detects that you need some sleep, it will help you sleep better. If you are stressed, it will help you cope with stress, you know. And then magnesium is great, especially if there's tension, because now your muscles are, there's tension because your muscles are in like a spasm kind of state. So they are like this. You need to ease the tension so that the pain will get better. And then there are headaches you experience, especially after, maybe for a girl, after losing blood, after your menses. That could be due to losing blood, could be some anemia going on there. Because of that, it could most probably be iron. But remember, you cannot self diagnose, especially for anemia. If you need to confirm, you need to take the test, necessary blood test to confirm the diagnosis. But in logic, if you lose a lot of blood, then you don't have enough capacity. Your cells don't have enough capacity to be carrying oxygen around. If you have less oxygen moving towards your brain and elsewhere, you might get headaches because there's no oxygen. The brain needs it, So now it starts compensating. You get headaches, and with that, you become dizzy. You can become dizzy because, firstly, there's low blood, and now anemia along with it. So you can become lightheaded. Um, so look out for that. Hence, I said note when it happens, and note the times, when, what makes it better, what makes it worse. So look out for those. Another thing that you really need to be aware of is taking pain tablets all the time. This thing, especially a paracetamol, it is advertised as very safe, but with time, it can mess up with you. So NSAIDs, or non-steroidal um, pain medication, anti-inflammatories, they can really affect your kidneys. They can really affect the lining of your gut. You might start developing ulceration of the gut because of taking it excessively. So if you have to take painkillers for more than 5 days, there's definitely something wrong. You need to have a look. You need to consult. And find out what the cause is. You cannot be staying on painkillers. Come on now. Now you want to make the matters worse. So as soon as you notice that, now I've been using these for more than 2 days, is even max. 5, like, is the upper limit of max. You need to have consulted by then. Don't stay on painkillers. Find out what the cause of the headache is, and then have it treated. Some people who are epileptic can experience headache after or before. So it's different for every individual. Same way, epilepsy can be different in its expression. The headache can also be different in its expression. So the most important thing to note is how often it occurs. If you have to take painkillers excessively, then you have to consult. If it is the worst headache of your life, you have to consult. Thank you for sticking around until this time. Please remember to subscribe. Please remember to like and share, and not just do it for yourself, but share the information so that it gets across. Because we know, there are people. Anyways, till we meet again next time. Bye.